Years ago, people were frightened by venereal diseases, they called them in those days. Now they're STDs, that were impervious to the latest drugs and would ravage the body and destroy people. Well, imagine you got an infection. You may have gotten it just in a hospital that even the most powerful drugs can't kill. The Centers for Disease Control is warning that could happen because of bacteria that now can resist antibiotics. And how do those bacteria get that way? Laurie Johnson is going to tell us.
For 70 years, we've relied more and more on antibiotics to fight infections, to the point where some bacteria have gotten so strong drugs can no longer kill them. An alarming CDC report reveals these bacteria infect around 2 million Americans each year and kill 23,000 of them.
Antibiotic resistance is one of the most serious health threats we face today. We risk entering a post-antibiotic era where even simple infections can be deadly.
At the top of the list, C-diff, a bacterial infection that targets the intestinal tract and kills 14,000 people a year. That's followed by drug-resistant gonorrhea, an infection making up about a third of the cases of this sexually transmitted disease. And CRE, a respiratory bacteria infecting 9,000 hospital patients a year, killing half of them.
I've called CRE a nightmare bacteria. It can resist all antibiotics, kill a high proportion of people it infects, and spread from person to person and bacteria to bacteria readily.
The CDC blames this resistance on the overuse of antibiotics, saying half of the prescriptions given by doctors aren't even necessary. Dr. Nancy Cardori agrees. As an infectious disease specialist, she points out that antibiotics kill only infections that are bacterial, not viral. But most of the time when people are sick, they have a viral infection and therefore don't need an antibiotic. The problem is there's no way to instantly know whether an infection is viral or bacterial. So doctors tend to give all of their sick patients antibiotics to help the few patients who actually need them.
Because one of the things physicians worry about, okay, if I didn't give them antibiotics, they went home and next day they're really sick and they don't come. And something bad happens.
Antibiotics aren't just overused in humans, they're also unnecessarily given to animals raised for food. In fact, animals receive 80% of all antibiotics, and much of that goes into their food.
It is being found that if you give them some antibiotics in their feed, which they don't need for infection, it makes them bigger, quicker, so they can be sold to the market quicker. So it's a more of an economic issue than animal health issue.
But it becomes a health issue for humans when antibiotic-resistant bacteria get passed to people. The FDA asked livestock producers to voluntarily stop adding antibiotics to feed, but not many have complied. Antibiotic overuse is only part of the problem. To make matters worse, drug companies aren't developing many new antibiotics to replace the old ones that aren't working anymore. Drug companies need to make a profit, and these days there's not much money in antibiotics. As a result, only 2 new antibiotics have been developed in the last 5 years. So while using antibiotics less and developing new ones helps slow down the spread of drug-resistant infections, we can also better protect ourselves from getting them. Washing hands, avoiding people with infections, and getting a good night's sleep go a long way. Hospitals also need to reduce infection. Check with your state health department to see which hospitals have the lowest infection rate. Dr. Gene Burke heads one of Virginia's top healthcare systems. He says you, the patient, can also help reduce your chance of infection.
And every patient should feel totally empowered to say to everybody that walks in the room, have you washed your hands? Would you mind doing it now?
Many hospital infections strike at contact points where devices go into your body. So the sooner they're out, the better.
Talk to your care team and basically try to help them know that you expect to have the fewest number of things put into you that's necessary, and that you would like them every single day, if you have a catheter or an IV in, to answer the question, is it still necessary today? Every single day, ask and answer that question.
While antibiotic-resistant bacterial infections pose a critical health threat, the trend can be reversed.
There are 4 things we have to do to protect antibiotics. First, prevent infections and the spread of drug-resistant bacteria. Second, use antibiotics much more responsibly. Third, track resistance patterns. And fourth, develop new drugs.
Lori Johnson, CBN News.
Well, it's scary. Do you wash your hands often?
I do. Well, especially now we have babies in the house, so we have little
babies
hand sanitizers
are
everywhere.
breeders of that stuff, aren't they?
Well, I actually think we might breed it to them. I don't think the
But
baby
so when
might
you have
be the
children in
innocent.
school, they come home.
Oh, my goodness,
And you're just constantly getting sick because they're exposed to these things.
Well, think about things that we do every day, like going to the grocery store, putting our hands on carts, or any store for that
Yes.
matter. And, you know, I mean, everything is just fraught with germs. So what do you do?
Well, I think hand washing. You remember the horror stories that came out of, say, the 19th century about women who were getting all kinds of pelvic infections because doctors would, operate on somebody with a serious condition or maybe handle a dead body. Then they'd go deliver a baby,
my.
And they wouldn't wash their hands. And there was a guy named Lister who was, began to talk about this, but it was resisted by the medical profession. Now, I'm grateful to many hospitals that have a little dispenser of antibiotic cream in the hospital, so when they leave the room, they're supposed to put a squirt of that on and wipe their hands.
That and almost everywhere that I've gone, in doctors' offices, dental offices, hospitals, I mean, the glove use is unbelievable. I mean, they're really pretty careful
thank
about
goodness
that.
they finally waked up, but boy, a lot of people have suffered. But that's it, ladies and gentlemen. You go out and you shake hands. What do you know? What did that guy do with that hand before he shook your hand?
Oh, dear.
I mean,
Just wave to your friends.
hey, Charlie, it's good to see you. Please come again. But hand washing, or get some of that antibiotic lotion.
They have so much of that now. I think a lot of people carry that around in the pocket or a purse.
But if you're out shaking hands with people, you can be assured one or more of them has got some kind of a flu virus or some kind of a virus, and you can get rid of it. Hand washing, it's so simple. Okay.
That makes politicians' work difficult.
Oh, man, yes.
Hello.